And I've got some fantastic news to bring you today on the success of the vaccination rollout and the protection that it's bringing right across the United Kingdom right now. Yesterday, we delivered 529,119 vaccinations, more than 500,000. And that means that today, exactly 100 days since Margaret Keenan got that first authorised jab in the whole world, we have now vaccinated over 25 million people across the United Kingdom. It's been such a national mission, one of the biggest logistical exercises since the war, and I've had the honour of playing my part, we've had the honour of playing our parts. It's been a huge team effort, and I've got absolutely no doubt it's the best project I've ever been involved in. And I want to say a huge thank you to everybody who lent in and has done so much to put this country in the position we're in, where we've been able to vaccinate almost half of the adult population, 25 million people. And I think that it's nothing that any of us who've been involved in it from the start will ever forget. But what really matters is why this is making a difference. And we have some very exciting information for you today about the real world impact that the vaccination rollout is having. If we could have the slide, please. This slide shows over time the increase in the proportion of people who actually have COVID-19 antibodies. Those are the antibodies that are so crucial in our ability to fight the disease. This chart isn't measuring how many vaccines have been done, it's actually measuring the proportion of people who have the COVID-fighting antibodies swimming around in their bloodstream. This chart represents the fact that the vaccine is giving the country protection. And as you can see, it runs up to the start of March, and it shows around 90% of people aged around 70 and above at that point had these antibodies, and it has continued to expand further in the 2 weeks or so since then. The chart explains why deaths from COVID in this country are now thankfully falling so fast. They're down by over a third in the last week again. And the vaccine is saving thousands of lives right now here in the UK. And it can give us all hope. And Professor Van-Tam is going to say a little more about this and the safety details in a second. And all of this underlines how important it is that when you get the call, get the jab. I find this data really compelling. And to anybody who still has concerns or any doubt about getting the jab, we know that the vaccine is safe and helps make you safe. It gives you this protection. And Dr. Mary Ramsey is with us because she's going to set out details of a publication that Public Health England have just released with more evidence of the impact of the vaccine to show what this protection is like. And that shows that after a single dose of the vaccine, either vaccine, protection against COVID-19 is around 60%. That's protection against getting it. Protection against hospitalisation is around 80%, and protection against death is around 85%. And one of the other interesting facts that is really important is that the vaccine offers protection to you, but it also offers protection to those around you. And the data show that if you live with someone who's been vaccinated, you have a 30% lower risk of catching COVID-19 yourself. This is the first data that directly measures the impact of the vaccine on reducing transmission, and it shows that the vaccines are saving lives. Both vaccines being rolled out in the UK are not just safe, but they make you safe. They're saving lives and protecting people. And because we're rolling out so fast, and because we've protected so many people so quickly, we're now able to extend the offer of a vaccination to yet more people. All people aged 50 and above are, from today, invited to come forward and get a jab. The NHS will contact you, and today we're sending over 2 million texts and letters and invitations to get vaccinated. Anyone aged 50 and over can now sign up on the nhs.uk website or call 119. We're on track to offer a first dose to everyone in priority groups 1 to 9 by the 15th of April. While we deliver on that commitment, we also want to ensure that this offer reaches everyone in groups 1 to 9. So, at the same time as opening up offers of vaccinations to all those who are 50 or above, we're going to do whatever it takes to reach all those in the most vulnerable groups who haven't come forward yet, before we move on to the next cohort, which is people in their 40s. So my message to our huge team of vaccinators is, let's keep getting the numbers through the doors, but it's absolutely critical that we reach out and we loop back and we invite in yet again all those who are in vulnerable groups who haven't yet been vaccinated. I want to get those percentages of the people in vulnerable groups, the percentages who've been vaccinated, I want to get them right up, reaching every last vulnerable person, and it is worth that extra effort. And we'll do that before we move on to people in their 40s. Now, I'm 42, and I'm as eager as anyone to get the jab. But before we forge ahead, I want us to be confident that we've done everything we can to protect those most in need of protection. And we will do all we can and do everything necessary to secure the supplies that are contractually committed to protecting people in this country. So we're moving in the right direction, thanks to everybody following the rules that are keeping us safe now, and thanks to everybody coming forward to get a jab that will keep us safe for the future. Now is not the time to waver. We're on the road to recovery. The vaccine is our way out. We are on track. So let's stick with it, follow the rules, and when you get the call, get the jab.